Good evening and welcome to our second New York State Vaccine Equity Fireside Chat. Um, there are people still coming in, but we're going to get started. My name is Louise Square, and I'm the Health Equity Coordinator for the New York State AIDS Institute. I'll be your moderator for the evening, and we're going to start with just a quick overview of what the evening's going to look like. So, I'm already welcomed you. So, we're going to go over some housekeeping tips. Then, we'll have some opening remarks from our Secretary of State, and then there will be a panel discussion, Q&A, and a closing statement. Next slide, please. So housekeeping tips. To ask a question, please use the Q&A feature to ask your question. We actually have two forms of communication during the hour, the chat and the Q&A. As the panelists and I begin to bring our conversation to a close, you'll be asked to put your questions in the Q&A. I know that most of us are used to using the chat, but the Q&A will allow us to see your questions more easily. So replies will be seen in the Q&A window and may be answered live or out loud. If you need assistance during the meeting, please contact privately a staff co-host through the Zoom chat feature. Next slide, please. And so without further ado, we're going to have some opening comments from the New York State Secretary of State, Rosanna Rosado.
Thank you. Thank you, Louise. Good evening. And thank you all for joining us for this incredibly important discussion. I know it's evening, but this event is part of a series of fireside chats that we plan to host to complement the work of the New York State COVID-19 Vaccine Equity Task Force. The task force is made up of a number of individuals who serve as key subject matter experts across the state and are charged with developing recommendations and strategies to aid in vaccine uptake in communities of color, the creation of culturally competent educational materials, and identifying vaccine sites to help meet all populations where they are. I appreciate so many of you taking the time to join us this evening, and I thank you sincerely on behalf of all the task force members and on behalf of the governor. There are things that government has to do, but there are many things that government cannot do without your help. As many of you know, health experts have projected that in order to win the war against COVID-19, between 75 and 85% of the population needs to receive the vaccine, and as such, New York has made it a top priority to ensure vulnerable and underserved communities are not left behind. This talk will focus on the importance of staying informed and community coalitions, breaking down the myths, sharing information, and focusing on the importance of leveraging the strengths of our communities. This will be essential to our successful efforts to vaccinate New Yorkers. We hope you find tonight's discussion informative, and we thank you for being with us. And we also thank our incredible speakers and all of you for attendance and participation. As I said, government can do a lot of things great, but we cannot do this alone, and we cannot do this without your help in keeping our ear to the ground and also meeting people where they are. So with that, I'll stop there and wish you well this evening.
Thank you so very much, Madam Secretary, for your opening remarks. Next slide. So now I'm going to introduce the panel. I'm honored and privileged for this opportunity to have this discussion with two highly respected advocates that have dedicated their time and efforts to serving underrepresented communities such as the LGBTQ population and the homeless population, and who have been in the forefront of the ongoing fight for equity and social justice. Both of these individuals have extensive and impressive bios, so we condensed them a bit for the sake of time. Let me first introduce Bobby Watts. He's the Chief Executive Officer of the National Healthcare for the Homeless Council, which supports the 300 federally funded healthcare for the homeless programs and 100 medical respite providers with training, technical assistance, sharing of best practices, research, publications, um, active policy, and advocacy program work to eliminate homelessness. He has 30 years of experience in administration, direct service, and implementation of homeless health services. Mr. Watts has a master's degree from Columbia University's Mailman School of Public Health, and he also earned a certificate of theological studies from the Alliance Theological Seminary. Our next guest is Jason Starr. Jason Starr has over a decade of experience as an attorney, educator, organizer, and innovator in civil rights and social justice policy. Currently, Jason is the inaugural director of litigation at the Human Rights Campaign, the nation's largest LGBTQ civil rights organization, where he is building a strategic hub for collaborative pro bono impact litigation in partnership with private law firms and grassroots legal activists. He serves as the lead counsel in the Walker versus Azar um, um, case, challenging the former Trump administration's attempt of rolling back critical civil rights protections for the LGBTQ people in the Affordable Care Act, and represents, I'm sorry, I'm going to mess this up, Amici on a number of high profile cases addressing LGBTQ equality, state and federal court. I just want to thank you both for being here. So during our conversation, we plan to talk about how our communities receive information. We know that our communities of color have had a network with which they give information and receive information. That goes as far back as, you know, the codes that Native Americans used and slaves when they were with the Underground Railroad. So we know that those networks are in place. So we want to figure out how to best utilize those networks to get accurate COVID information about COVID vaccine. So we welcome our guests to share their knowledge and experiences in the way they find most helpful. The most important thing we'd like to get out of this conversation is information that will help our communities make an informed decision. We only have a short time with you, so let's jump right into the discussion. So our first question is, again, it's about staying informed. So how have communities created grassroots supports from within to get through difficult times? I will throw that out to either one of you.
Bobby, you want to start?
Well, Jason, can you start? I understand that Bobby has lost his connection.
Okay, sure. Well, I think Louise, first, thanks to the AIDS Institute and the Vaccine Equity Task Force for the invitation, and for producing and providing this information to add to all that we know that government is doing on behalf of communities, especially those communities that have been most impacted here in New York by COVID-19. And I think you started, you harken back that mutual aid is probably as old as human civilization. But I started thinking about the Free African Society in Philadelphia in the late 1700s that actually started as a result of a yellow fever outbreak. And so we have a lot to learn just from our own history here as it relates to how we came together after a pandemic. But I think of the secretary started us off by saying government can't do it alone. And any time where government and institutions have been unable to meet people, folks who are themselves separated and disconnected from those institutions, you've had these networks that come in that are essential. And I know what I've seen over the last year is really a resurgence in figuring out how do we meet some of the most basic needs that so many of us in our community are facing when so many of the ways in which those needs have previously been met, or the ways in which our institutions and governments have been set up to meet those needs just couldn't happen anymore because of what COVID did to our infrastructure, our community infrastructure, our information infrastructure, et cetera. And so, I think it's really just a revisiting of those core principles in the context of our current situation. I'll shout out organizations like in my backyard here in Bedford-Stuyvesant in Brooklyn, Bed-Stuy Strong, which grew into a massive community-based mutual aid network. And it was really about those of us who had being able to identify those in the community who need it and just meeting that need immediately. And hopefully being able to present those robust networks to government so that not only information about the virus and the vaccine can make its way through those networks to folks in our community, but that those networks can themselves be a bit of a political statement about how we need to think about meeting needs in the current moment, but all of the ways in which we're going to have to utilize or be able to utilize these networks to meet the ongoing needs as we begin to recover from the pandemic. So I think, you know, whether we have community-based organizations on the line, whether we have clergy and faith communities on the line, so we have a lot of people who already know the nitty-gritty of direct contact, of door knocking, of phone banking, and are really sort of reconceptualizing that in the new ways that we have to get information to members of our community that really need it.
Thank you so much for that. Bobby, did you want to chime in? We
Yes,
can't
can you
hear
hear
you. Yeah, now we can hear
Can you
you.
hear? Thank you. I apologize for the technological difficulties. I think Jason said a great deal, and I just really want to bring in the perspective of people experiencing homelessness. He began by saying when communities are cut off, they develop ways. And I think that has really been a strength. When I began many years ago as a living counselor at a rescue mission, I was amazed at the sharing of information that was necessary for survival, where to go get food, where to get clothes, where to get resources, who to trust, who not to trust. And those networks help to make it resilient and help people to survive. The difficulty is if those networks stay cut off, then misinformation can flourish. And so it can be both the strength and the weakness. So the key for government and for communities is how to prop up the strengths of those communities, the grassroots efforts, while making sure that they have the support and the correct information. So I think that's really important in many areas, but especially as we are thinking about how can we help people make informed decisions about getting the vaccine. First, they have to have access, but then they also need to make sure it's an informed decision.
Thank you for that. So you both said something very important. You talked about the strength of communities that is already there. So I was going to go in a different direction, but since you've already addressed it, because you talked a little bit about the church. And so we have a lot of faith-based members here. So what roles do you take? You alluded to a bit, but what roles do you think that faith-based communities can take to help educate their communities?
I'll start by saying I think you know, our clergy and faith leaders are, you know, some of our most recognizable, some of our most trusted, and so I think you know, I think it's already happening, and I'd love to see it continue happening for clergy to really take a leadership role in the messaging and the disruption of the misinformation. I think our churches have been great navigation spaces to get folks into the information channels, to get questions answered. And I think that that's going to be really important. And I should say here in New York, because of our diversity, doing that in an interfaith manner, you know, really speaking as a religious and faith community writ large across different faith traditions and denominations is a strength that we have and something that we should definitely lean into in our strategy here in New York.
Absolutely. Bobby, did you want to chime in?
Yeah, that is exactly correct. There's a reason why it's trusted, why churches are trusted, and especially when it comes to healthcare information. One, they are in the community, they're of the community, and in some ways they are trusted on face value, even more so than healthcare institutions, where it may be felt that they have a vested interest in steering you in a certain direction. So, and we know there has been historic racism and current racist and biased practices in healthcare institutions in a way that it's not generally in the faith-based community church or synagogue or mosque that's right there in the community. So they can be extremely important, and it can be important for members of their congregation to have health providers address the congregation, but then also to address the community with this information. It's an important strength that we are tapping, and Jason mentioned in Bed-Stuy. I grew up in Brooklyn, the borough of churches, and it's really, really important that we really tap into that strong network.
Yes, Bed-Stuy strong. That's where I'm talking to you from. So I'm going to move a little bit. Bobby, this question is for you in particular, but Jason, you can certainly jump in. The pandemic has devastated many communities in the last year. How has COVID-19 impacted homeless populations specifically?
Sure, and I will try to be brief because it's so many parts to the answer.
I know.
But first, I will address it in healthcare, in non-healthcare, and then health, and then the health status. First of all, what many people may not realize is that many of the institutions and resources that people experiencing homelessness were greatly affected by the pandemic and greatly dried up. Many shelters had to reduce their census to maintain social distancing. Also, soup kitchens had to close because the volunteers tended to be older people who it was not safe for them to be in that congregate setting, so people lost food. Food insecurity really increased. And also people lost access to their regular form of healthcare. And many of our healthcare for the homeless programs around the country really did an admirable job of switching to telehealth, but that depended upon people having phones and data in their plan. So we had to adjust how can we provide that for them. So the impact on the health status, from the very beginning, we were extremely concerned that people experiencing homelessness were at extreme risk for contracting the virus, and because of their poorer health and greater number of underlying health conditions, would be at great risk once they were exposed to the virus of having very poor health outcomes. Many cities, including New York, but around the country, did things that were unprecedented. One of the positive things is that it really cemented the relationship between housing and health. We always known it was there, but this has brought that into stark relief. Just think, there was an eviction on moratoriums, a moratorium on evictions, that was issued by the CDC as a public health measure. They said, for years, the Healthcare for the Homeless Council has been saying housing is healthcare. I know I first heard that in working with the AIDS community, focusing on addressing HIV, understanding that housing is healthcare. Now the highest public health entity in the country, they have endorsed that wholeheartedly. And many cities put people from shelters who are in frail health, put them in hotel rooms so they would not be in a congregate care setting, took them off of the streets so they could be safe. What we feared was, I think that greatly lessened some of the impact, but yet it was a really great, still a great impact. Some of our data that the council is collecting and it's being analyzed by the CDC shows that just for surveillance testing, not symptom-based testing of someone saying, I feel sick, so I want to get a COVID test, is showing about 8% of those tests and among people experiencing homelessness are positive. About 4% of people who work with people experiencing homelessness, the staff of the shelters or the homeless program. And we have some data, but not very great data around the death. How many people have died who are experiencing homelessness because of COVID? But where we do have good data, namely LA and New York City, we have good data on the number of people experiencing homelessness, the cause of death, and we see it's elevated in LA, in New York City, for the early part of the pandemic. We saw a 78% higher age-adjusted mortality rate from COVID among people experiencing homelessness. So though a lot of the cases are asymptomatic, that's bad. It is good and bad because the spread is asymptomatic. And you may have it in congregate settings, you may not know that they're passing it on to someone else. And for many people, that has resulted in death, unfortunately, at higher rates than even in New York City, which has been one of the highest death rates in the country among people experiencing homelessness.
Oh, okay. Yes, I want to circle back to you, but Jason, did you have anything to add?
No, I mean, I think just echoing, Bobby, I think there's, what we've seen in my work, particularly with LGBTQ populations, and I know this is true for so many others, is that you start to see the ways in which those intersecting marginalized identities, those identities that tend to bear disease burden across the board at greater levels, those conditions start to intersect. And one concern is that, as Bobby mentioned, housing is healthcare, and so we see, say, for example, LGBTQ young people, or more specifically, trans women of color, lack employment opportunities, which leads often to lacking stable, safe, supportive housing, which then leads to greater incidence of catching the virus and potentially having poor outcomes based thereon. So I just think it's important for us, as we think about equity, to always sort of think about what ways in which all of these identities kind of compound the burden of disease that individuals and communities are bearing when we think about what our responses are.
Thank you for that. And this is such an important conversation. We identify housing as a social determinant of health. And so when we started to think about when the pandemic first began, and we were basically being told that there were certain people at higher risk, I don't know that people thought about housing health and how that would impact folks. And so this is a little bit, I'm reaching a little bit more into your question, but I guess, you know, how there was a moratorium placed on evictions, and there were things put in place to make sure that people had so at least some temporary housing. How do we move that forward? How do we make sure that people can remain safe, especially while we're making sure that people are vaccinated and we try to get to that critical mass of 75 to 85% of people? How do we maintain that?
Yeah, I think that we need to try to keep those measures in place. The incoming administration, first, the former administration extended it from December 31st to the end of January. The incoming administration, in an executive order yesterday, said it's going to be at least through the end of March while they work out. So we really need to figure out how we can keep this in place. I would argue we should make sure we keep it in place from a public health point of view, at least through the pandemic. But I would also argue from a public health point of view, we should find a way to maintain it. And fortunately, the Biden administration, and this is someone's been working at the intersection of healthcare and housing for a long time, and I checked with my colleagues, the Biden administration, for the first time in any of our memory, has made a proposal that there should not be a limit on Section 8 vouchers to make housing affordable, but it should be available to all that need it. Currently, there's only funding enough for 1 out of every 4 households that qualifies for a subsidy to make their housing affordable. So they're saying, no, we should at least do that for everyone. And I think if that can happen, if it's not just a proposal, and we may need to put pressure on our representatives, we may need to make our voice heard to make that happen. That can mean the difference between life and death during this pandemic and beyond, and help to prevent the next pandemic from being worse than it needs to be.
Yes, thank you. Jason, did you have anything to add?
No, it's not all about evictions. The evictions are one piece of it, but I'm 100% with you, Bobby. This pandemic, the challenges can present really great opportunities for us to really change narrative and reach to correct, policy failures that we're understanding perhaps more than we did before. So where the light shines on a need, let's lean into that because, as we said, the nation's top healthcare institution has said as much with regard to the importance of housing as an immediate response to this current pandemic.
Thank you both. I'm going to go on to the next question I have for you. And look, this is probably more directed towards Jason, but both of you can answer. When the vaccine becomes more available to the public, do you see any obstacles as it relates to undocumented immigrants accessing the vaccine, or particularly due to the fear of legal action?
Absolutely. I mean, you know, I guess we can start with the environment, and even though I think we're all more hopeful in terms of the political environment, particularly around immigration policy. You know, the last few years, you've had a federal government that started the administration claiming to ban Muslims from entering the country, really ratcheting up deportations and detention of folks who have been in the country for decades. You know, our neighbors, our family members, for no real apparent public safety reason. And so that we're operating in that environment. And so I think that there are a lot of hesitancy amongst immigrant communities, whether it's folks who are undocumented, mixed status families, about what does it mean for me to go get the vaccine? What information is going to be collected? Can that information be used for immigration enforcement? And even though, you know, it's important for us to make sure the correct information is out there, the federal laws and guidelines don't permit information to be used, don't allow for the disclosure of personally identifiable information. We also have all of the health privacy laws that would apply to folks regardless of their immigration status. But you know, all of that exists in a certain environment where it's very understandable that, you know, immigrants and immigrant communities are reticent about getting the virus for what it might mean for their safety and other aspects of their lives. So that's going to be a big issue. I think it's really important here in New York, you know, to name that we already have really strong protections for our state agencies to make sure that information. So when you go to the DMV, when you go to get public assistance and benefits, the framework is already there in New York State to make sure that information. That was one of the first things we did as a defense for communities against the federal government. But I also think, you know, part of it is also going to be, you know, so many of our folks in our immigrant communities are not eligible for certain kinds of benefits and coverage as it relates to healthcare. So we also have to sort of understand that there are issues about whether it's going to be covered, what the cost will be, you know, and again, bringing in all of the ways in which immigrants, undocumented immigrant communities are overrepresented in certain professions. So there's a lot of layers, again, as I mentioned before. And again, we're talking about information and how to get the right information out through the right networks. And one of the benefits of the situation that we've gone through with regard to immigration policy over the last 4 years is that the legal and policy defense networks have been built, whether that's, you know, defending against deportations and detentions, or educating people about anti-immigrant policy. Those networks of lawyers and trusted community members and folks who have the language and cultural competencies and capacities are there. It's just a matter of, can we make those really important linkages between government and those networks to overcome challenges that we've seen, similar challenges that we've seen as it relates to how to engage those communities.
Yeah, and that's where our participants come in. Hopefully they can help to get that message out. And I think what you really said that was important is that there are certain privacy laws in place that should not prohibit people who are undocumented from coming forward. Bobby, did you want to chime in? And I just want to remind participants as we're moving through our questions, if you have a question, please put it in the Q&A and we'll try and get to it. Bobby, did you want to chime in on this one?
Just very briefly, you know, as Jason said, there are protections in place, but if people don't know that, and they avoid, then it's like not having protections in place. And one of the things is for federally qualified health centers. I ran one in New York City for many years, and now head of an association of federally qualified health centers focused on healthcare for people experiencing homelessness. All FQHCs are to provide care to people without regard to their documentation status. So, but many people who are undocumented don't know that, so they will stay away from getting the necessary care. So depending upon partnerships to get that information out so that they know they have this protection and that they trust that it will be enforced, that we won't turn over their information to ICE or whomever is so, so essential. We see that especially in this pandemic where the health of some can easily affect the health of all. And so we have to protect the health of all and make sure healthcare is accessible to all.
Thank you so much for that reminder, especially about the FQHCs. So I'm going to move to the next question, which, let's see. I'm going to direct this to Jason because from my understanding, you were involved in the vaccine trial for COVID-19. How did you feel as a person of color participating in the trial? And did you get any pushback from your peers or family members? And if so, how did you respond?
So I am a participant in a vaccine, COVID-19 vaccine trial, a phase 3, longer term, a 2-year trial of the AstraZeneca vaccine, which has not gone up for FDA approval just yet. And I did it really for 2 reasons. One is, I wanted to be well informed and have a first person account. It is a phase 3 trial. And so there was some data and information about the vaccine that was there beforehand. But I was just really interested in taking advantage of the opportunity, to be a participant in trials when, Black folks and queer folks are underrepresented. And I know last week, Dr. Maybank and Dr. Blackstock, I think both talked about how these trials are getting a little bit better at reflecting the population demographics, because we need to know more about how these vaccines affect Black folks and other folks by being participants in the trials. But I will say my neighbors and my family, as I began to sort of talk about, the vaccine and vaccine hesitancy and medical mistrust, we're about 50-50. My mom, she works in healthcare. She just got her first dose today in South Carolina. Shout out to Vicky Starr, so proud of you. But she's very much like, knowledgeable about it, and she's sharing information with supportive. And sort of there were 50% that were like, oh no, I'm not, So I figured, in my network, right, my neighbors, I live in a Black neighborhood, my family, I felt like it was about 50-50, right? And so I thought, if I can be another voice, right, sort of first person, contribute to our longer term understanding, and potentially also just learn myself about vaccines, about how this vaccine was developed so quickly, that I could be a first person messenger. And it's been it's been a great experience. I've been a participant with Project Achieve, which is a unit of the New York Blood Center that focuses on HIV prevention, intervention. And so the clinical experience has been great, and the ability to really go out and talk about it has been great. And there's been a lot of interest amongst my neighbors and my families and my peers just about following up. And I even got a few people to sign up for the trial. So even though vaccines are being approved and even though we're distributing them, there are still vaccine trials going on. And so it's still important for folks to join if you're able to, because I'm going back for follow-up over 2 years, and that's how we're going to get the data and understand more long-term the efficacy and effects of this vaccine and others.
Wow, thank you for that. And that's funny. That was going to be my follow-up. Like, how long are they following up with you? So thank you for that. I'm going to ask one more question before we go to the Q&A. And again, I'm going to remind folks, I do see a question in the Q&A, but again, I'm going to remind folks, if you have a question, please put it in the Q&A. We did leave time to answer your questions. So just before we go to that, I'm going to ask one more. According to the CDC, underrepresented populations are at disproportionately higher risk of contracting and dying from COVID-19 when compared to other groups. What specific messages or interventions do you think would best reach underrepresented populations to reduce the burden of COVID-19? And I'm going to start with you, Bobby. I think especially since it seems that your passion and your reach is for the homeless. What messages do you think would reach that group? Not, you can expound, but definitely that group.
Sure. I think the keys are true for all marginalized group, but it has to be targeted. And that, I think, is the key. While we are going to have mass education campaigns, which is really important, it also has to be supplemented by micro campaigns. So one of the most important things is that the message has to be accurate and it has to be delivered in ways that people can access it. So when I was running a health center, my staff, we talked about health literacy, and that was like, how can we inform the patients of the vocabulary that we use? I said, no, that's not health literacy. Health literacy is how can we target our message in a way that's understandable to everyone. So it has to be accessible, it has to be accurate, and then it has to be trusted. And to be trusted, it has to be relevant to them, and it has to be delivered by a trusted messenger. And to be trusted, you first have to be trustworthy. So that's why I mentioned some of the advantages that churches have. They don't have the baggage that in healthcare that health institutions really have, and not just from the history, but also from the current practices, which are inequitable, racist. We know there's still bias among health providers. So if someone doesn't believe that you have their best interests at heart, why would they trust you with the matter of life and death? So delivering it by people they trust, maybe it's a formerly homeless person, maybe it's a peer worker, community health worker, or by a medical provider that they have developed a trusting relationship with. So targeted information that's accessible, that's understandable by trustworthy messengers.
Thank you, thank you. Jason, did you want to respond to that before we go to the Q&A?
I think Bobby said everything that needed to be said. Cosign ditto, 100%.
Same here. Cosign ditto, 100%. Okay, so Ashley, do you want to give us our first question?
Yes, and I just want to say thank you to you both. This has been great discussion. So we do have some questions. So from Akil Salter, every step taken has a consequence. Rent moratoriums also negatively impact homeowners who cannot collect rent and put many at risk for losing their home and property. The rush to get the vaccine now alienated many, especially of color, who have distrust of the government / pharma. And many in this population are, can you hear me? Are refusing to get the vaccine out of concern. How would you address these concerns?
I'll start. I heard two questions to make sure I understand it right. One part is that the government action has hurt small homeowners with the rent moratorium, and that has just led to a general distrust of the government. That along with many other things. So first, concretely, I think fairness dictates, and I believe that the new administration, but even former legislation was going to address how to provide funds to those who lost rent during the rent moratorium. Now, it's a moratorium. It's not saying that the rent that's due is wiped out. It's just saying for right now, you don't have to collect it. So somehow there's going to have to be a way so that when the rent bill, accumulated rent bill is due, that people aren't kicked out. And that is time to also make homeowners to some degree whole. So I believe that should happen. I believe there are plans to make that happen. And the problem with government is a pervasive one, and that's on left and right. I'm living now moved to Nashville, Tennessee, which is a blue city, but right around it, it's red, and you hear distrust from the government from all sides. The key is to try to just keep providing accurate information. I was at a webinar that Dr. Fauci held that was put on by the 4 historically Black medical schools and by Black doctors, and he really addressed their concerns, giving a lot of information in ways that they were obviously at a higher level in understanding, but the vaccines, the trials, the safeguards that were put into it, there's a way to take that information and make it accessible in trusted ways, as far as the vaccine goes.
Thank you. Jason, did you want to address that?
I think naming the reasons why individuals and communities bring this level of distrust is important. And when I said sometimes I am wary of the framing of medical mistrust, it's really because it indicates in some ways, or suggests, I should say, that those of us or those in communities with mistrust need to do some things to get over our mistrust, as opposed to indicating there are very real reasons, past and present, why we shouldn't trust the institutions and apparatus. So, I think it would be helpful for folks who are in on the service delivery side of this to really educate themselves and be able to understand the reasons and the instances where that fuel that mistrust, whether it be untreated syphilis at Tuskegee, which I think a lot of people sort of utilize as a paradigmatic example, but also forced sterilization of Puerto Rican women on the island, maternal and infant mortality amongst Black women today. I think understanding and being, when we talk about how do we meet people in communities where they are, that's where they are. That's the understanding of what it means to engage with a healthcare institution, or that's what people see sort of come out of those engagements. And so I think we have to sort of go there and say, solving or resolving medical mistrust is not going to happen before we need people to take this vaccine. So it's not like, I'm not trying to come and get you to trust the medical system. That's a longer term issue. But what we are doing is trying to bring you into this particular intervention and talking about why it's important for us, but also understanding and asking, why is it important for you? Because it might be, I want to keep my family safe. It could be, I'm ready to get back out and go to restaurants and bars, and all of those are fine. But I think, touching people where they are there really means stepping into and naming and acknowledging that we're not talking about past and history, we're talking about present.
Thank you. Thank you so
If
much.
I could just add one thing,
Sure.
this distrust, and Jason is so right, the distrust is real and it's valid, and it needs to be acknowledged that it's real and valid. There are legitimate reasons. And again, I want to go back to be trusted. You first have to show you are trustworthy, that you are worthy of someone placing their trust in your hand. And this also extends, part of being a national organization, I hear stories from all over the country. A health provider in Alabama had 50 doses for 125 staff. Most of their staff were Black. The first day they came, only 23 people showed up, and almost all of them were white. And there was even among the healthcare providers to work. But as they learned more, and as they saw what was happening with their colleagues, then more and more of the Black staff members accepted the vaccine and took it. And then when people see that it works with someone that they trust and that they're not getting too sick, that's the most powerful way. They may not trust the health system, but they may trust what the experience of their friend. So we really have to show that and acknowledge you have reasons not to trust the health system, but let's trust your eyes and the experience of your friends.
So true. So true. So I have one more question for you. As we begin to wind down, we recently commemorated MLK Day, Martin Luther King Day. And Martin Luther King was a man that stood for equality and social justice. How does equitable distribution of healthcare services and resources fit into the framework of equality? I know that's a big question. I know that's not a simple answer, but who wants to take the first stab?
If it's fine with Jason, I will. Wait, it looks like you're ready to open your mouth, Jason. I defer to you.
You were going to show me up. That's all I was worried about. I will say, I'll start because I do think, Bobby, you have something really powerful to say here. I'll just, refer back to a quote from Dr. King himself. We refuse to believe there are insufficient funds in the great vaults of opportunity in this nation. And so we have to throw out on the table that this requires resources. And I think we are, and when I say resources, I mean money. Let's, and we're in a, I think, we're in an environment right now, a scarcity environment, right? Like everyone, I think we're all sort of conditioned to understand that we're in a period of scarcity, but that can't necessarily be the way that we think about this. Our President Biden talks about fighting for the soul of our nation, and part of that is literally fighting for our health, and so we have to put all that we have into it and to prioritize it. So I think in the spirit of Dr. King, it's really about understanding that this isn't just a health issue, right? It's a justice issue. It's a racial justice issue. It's a gender justice issue, and an economic justice issue. And so I'm looking for us to really show up for communities that have borne the burden of disease in the ways that they've shown up for each other to fill the gaps. And I think Dr. King would call for, really a real investment, not just in words, but really in resources as well, because that is just going to be essential to mounting the kind of effort that we need to do right by communities that have suffered so much.
Thank you.
That was very powerful, Jason. You don't have to worry about me showing you up. But I will counter with another quote by Dr. King, which is that of all forms of inequality, injustice in healthcare is the most shocking and inhumane. And when we think about healthcare, it's one of the things like water that is essential for life. We won't succeed, we won't thrive, we won't survive without healthcare. And to have some people have healthcare in a nation of plenty, I agree, we have a false scarcity narrative. Is just really a matter of life and death for people, and we should not accept it. Part of our our new mission statement is it begins with grounded in human rights and social justice, and then it goes on that we view healthcare and housing as human rights. This is what's necessary for life. We want to put it in the American framework. The Declaration of Independence said there are certain rights that are inalienable: life, liberty, and the pursuit of happiness. Life, we need this to survive. If we want to live out the true ideals of our country, we need to stop treating healthcare to the degree that we do as a commodity for profit. And we are the most powerful country in the world and one of the richest, and none of the developed countries have the health disparities that we do. And that is because we view basic healthcare, not talking about cosmetic surgery and other things, but basic healthcare necessary for life as a commodity instead of as a human right. So there are many proposals for many years for single payer health coverage, like many other developed countries have. New York State, year after year, has been introduced in the Assembly. We need to move closer to that if we're going to get rid of the health inequities, especially those based on race, but all of them, where it's based on race, color, sexual orientation, where some people are excluded because they're not in power. We need to level the field where it's available for all.
Thank you for that. So we have another question in the Q&A. Ashley, did you want to share that question?
Yes, we have one question from Patricia Wilson. What suggestions do you have to engage communities of color, i.e. Divine Nine and other African American and Latino civic organizations, in this effort to educate the community about COVID-19 vaccine? Our organizations are working in the community, and seems there are opportunities to extend this connection with information about the vaccine.
Well, I'll start there.
Whoever wants to start.
Sure, and I think thank you for mentioning, in the question, just some of the other networks. You talk about the Divine Nine, in case anybody's out watching and doesn't know what that is. Those are the 9 historically Black fraternities and sororities that, again, were themselves in part networks, survival networks for young Black collegiate folk when our college campuses were far more hostile and when that environment was far more hostile. And so again, I kind of go back to where we started, which is we don't, we want to make sure government and our healthcare institutions don't try to recreate these networks that are already there. And also, to Bobby's point, don't rely too much on mass communication. I think the mass communication, especially around, I saw some of the questions either in the Q&A or the stack, just more sort of, I run a community center. How do I potentially become a vaccine distribution or testing center? I think government's really good at that kind of communication, but really looking at these community networks as partners. So if you're out there, I encourage you, if you're in New York City, like your community board, your local elected officials, reach out to the Vaccine Equity Task Force and let them know about networks that you have. I have 250 people in the Rochester area. We have a good group of folks in, the Southern tier that really need push in, really pull government into those spaces and networks. You know how your people connect. If you got your monthly meeting, if you're doing, if folks are doing cooking demonstrations, just get that information into the places where people are already consuming. And don't think about it as just a mass communications effort, but that partnership where you can micro target is where government, healthcare institutions, and the community are really going to make this work and make it happen.
I just say sign on, ditto, everything. I just add one small piece, especially in New York City, to also remember tenant associations where people are living together. When we think of a pandemic, that's really important. They have a vested interest in keeping each other safe, and they're neighbors. They know each other. There'll be some trusted ambassadors there, emissaries to the larger community. So the same principles, just want to think about New York City specific, and also remember tenant associations.
Yeah, and that's interesting you say that, because a lot of tenant associations, they're kind of affiliated with some of the senior center community, senior citizens community centers. That's another network and another group of folks that we're trying to reach. So yes, thank you for that. Do we have any other questions? Ashley?
Yes, there was one. Yep. Oh, sorry, I was just unmuting. There was one specifically for Jason when he was talking about being in the trials. Do you view this as an opportunity to educate communities, especially communities of color, to join research?
Yeah, absolutely. Like I mentioned before when I was talking about it, one of the motivations for myself is was to learn more about vaccine studies and other kinds of trials generally, and sort of digging into why people of color, Black people specifically, are underrepresented in these trials. And I really was attracted to the fact that there's going to be 2 years of follow-up. And one thing I didn't mention that I should is that you get paid for participating in these trials. Not something that I thought about in terms of doing it, but when I went, they asked me to fill out a W-4, and I was like, what is that about? And so I think that's important to note too, which is it does require your time and some light time commitments in addition to getting the vaccine, but it is something that I think as a community, one of the things that I want to do beyond just talking about the experience of the COVID-19 vaccine is really, learn more and be more of a messenger generally around this research and why it's important, and how we can benefit as communities by being at the table, both when these research studies are developed and also when they're being executed. Even if we're not at the table, we're on the menu, is the way I was thinking about it.
So we're just about, I'm sorry, go ahead, Bobby.
I just want to thank Jason for doing that. One of members of my board who formerly experienced homelessness happens to be a lawyer by training, also was a volunteer in a trial. And he said he did it. He said, as a 50-plus-year-old African-American man, I know we need this information. So I'm in that demographic. So I thank you, Jason, for expanding the body of knowledge.
Absolutely.
Yeah, we're just about out of time, but Jason, briefly, because there's been a lot of information circulating about side effects. Did you have any side effects? Did you have any discomfort from the vaccine?
So the trial is double blind. And so, about 2/3 of the participants get the vaccine and a 1/3 get a placebo. I believe that I got the vaccine. I got, as has been reported, pain at the injection site. If you've ever gotten a flu shot before, which is something else I didn't do until very recently, a couple of years ago, actually working at the state where it's provided, just a point to access, right, in the office right upstairs. I was able to go get it. So I had a little bit of that, tenderness for, a few days. And then I did get a little light fever, tiredness, about 24 hours or so after the first injection. And so we'll see. I'm going to go get an antibody test tomorrow, actually.
Okay.
And so we'll see whether I got the vaccine or the placebo.
Thank you for that. So again, we have about 2 minutes left. You just have one last statement before we close out and thank everyone? Something positive that you want to leave the audience with.
I thank you for your interest in this and for having me and the representing the council. Thank you for your interest in equity and making sure that extends also to people experiencing homelessness. I think that's a really positive development for the task force. I know there are people with this expertise on the task force, and just very, very grateful.
Thank you. Jason?
Yeah, I want to echo Bobby's thanks for all of the folks out there who've taken the time, dinner time, pre-dinner time, to come on and listen and engage. I'll just leave with kind of, one mantra or saying that, was so central to the movement that crescendoed in the streets this summer for racial justice. And that is who keeps us safe, we keep us safe. And I found, a lot of strength in that. Bobby talked about strength, community strength when we started. And I just want to leave folks with that. As dark as this period is, I do think that it has exposed some real strong community bonds. And I think that those coupled with, our government showing up for us pushing it to show up better for us at times, and creating that collaboration and partnership, we're going to see the other side of this pandemic and experience. And so I just pray, strength for everyone as we move through this, and just encourage you to always, each one, reach one, share the video and recording of this, take a look at last week's, continue to engage in the further weeks, because this is how we're going to survive and thrive through this period.
Thank you so much. Claire, can you move to the last slide? So I just want to remind folks, I'm sorry, Claire, I moved you too fast. You can go back to the one just before. I just want to remind folks that in the chat, you'll see a link to a document of frequently asked questions. We think it may address some of the questions that have been asked and continues to be asked. Please save the link for future reference, because as we get more information, we'll continue to update the information. And so in closing, I'd like to thank you, panelists, for your time that you spent with us this evening and for the information you shared. And I'd also like to thank the participants who took time, like Jason said, from their dinner or pre-dinner hours to join us. Thank you so much. Enjoy the rest of your evening, and we will be chatting with you again soon. Have a wonderful evening, everyone.